So, hello everyone. I cordially invite you to join us for today's Health Talk series. As you all know that I'm Dr. Soumya Dwivedi, the Director and Chief Radiologist of Cura Diagnostics and Research Center, Bhopal. And we have been conducting Cura Talks every month, and we talk about general health problems facing by women and pregnant women and even infertility every year. And this year's theme is actually pregnancy, and it's my proud privilege that Cura Talks is getting associated with IRI Kerala and IRI Bhopal. And we have a very awesome doctor with us, Dr. Priya Bhave Chittavar. She's also my mentor, and I'm so fortunate that she could join today. So let me quickly tell you some few great points about Dr. Priya before we start our Q&A round. So, Dr. Priya Bhave Chittavar is a trained gynecologist from Gandhi Medical College, Bhopal, and she's won 14 gold medals, and she's the best outgoing student and best all-rounder award achiever also. She's the first gynecologist in Central India to hold super specialty qualification in reproductive medicine from top University of India, CMC Vellore. She started the first DM course of India in reproductive medicine. So hats off to you, ma'am. And she's Foxy recognized trainer in infertility for gynecologists, and she holds a record for training more than 1,000 gynecologists in art and science of infertility management. She's helped bring more than 2,000 babies by IVF technique. She's performed more than 5,000 advanced pelvic laparoscopic surgeries. She's got more than 10 international and 25 national publications, and a special mention because she's an avid cyclist and a marathoner and an aspiring iron woman, I should say. So thank you so much, ma'am. Thank you for joining us, and we welcome you.
Thank you so much, Soumya. I'm really so excited that IRI, along with Cura, is actually bringing this awareness to the people at large. Usually, as professional bodies, we are content to sharing knowledge with each other, but it's so good that we are going out there and we are going to help the couples through this talk. So I'm really excited to be here.
That's awesome, ma'am. So without wasting time, I think we should start shooting questions. And so basically, ma'am, every month we do a poll, and these are some common questions which we've got from the public, and we're going to address the same. So the first question, very basic, what is infertility? Let's start with that.
So now what happens is that on one hand, we see a lot of awareness about infertility, and on one hand, there are people who are absolutely not sure when they have to see a doctor. Correct. So it's very important that every couple should know that if they've been trying for a year without using any protection, they're not able to conceive, then that's when they have to see a doctor. But nowadays what happens is that women tend to plan pregnancy later in life. So if the lady is more than 35 years of age, it is said that it's not a good idea to wait for a year. If after 6 months of trying you're not able to achieve conception, it's a good idea to see a doctor. Now, important thing is that most of these couples are not infertile per se, they are subfertile. So their fertility is slightly lesser. So usually with minimum treatments or medications, they are all able to achieve a pregnancy.
Okay, all right. So that's a very important point which ma'am has suggested, that there's something called as subfertile also. So don't lose hope over there. So my next question is infertility just a woman's problem, which is a very big myth, especially in India? And if that is not so, then does that infertility does affect men also? Ma'am, what's your take on this?
Absolutely. See, around 15 years ago, when I started my journey in infertility, it was very common to see the woman with her in-laws, with her friends coming into a clinic getting evaluation for infertility. But it's very important to understand that a woman might carry the pregnancy, she will deliver the child, but 50% contribution towards conception of this baby is from the male partner. And in fact, almost 20% of the cases, the problem is completely with the male. Correct. In 30%, it's a combined factor. So almost half of the couples actually will have some problem, either big or small, in the male partner. So if you're suffering from inability to conceive, don't hesitate. Please come to the doctor, and please come to the doctor as a couple. Should not happen that only the woman should present herself for evaluation.
Very, very important point. And I want to emphasize that yes, it affects both men and women. So please treat yourself together as a couple and not just send your wives into the clinic. So, ma'am, what are the common reasons which increase a woman's risk for infertility?
See, of late, what has happened is that there are two things which are coming up in a very big way when it comes to infertility.
Right,
If we talk of the urban areas, then there are two diseases. One is polycystic ovary syndrome, and the second one is endometriosis.
right,
Now, both of these will contribute to almost half of the cases of infertility when we talk of urban areas.
right,
If you talk of rural areas, it will surprise you to know that male infertility is on the rise because there's a lot of use of fertilizers, chemicals. So
right.
farmers often have reduced semen parameters because of this chemical use.
Okay,
And secondly, tuberculosis of the uterus is coming up in a very big way.
right.
So rural areas, the fallopian tubes getting blocked due to tuberculosis of the uterus is also a very big problem. So combine these four things: PCOS, endometriosis, tuberculosis of the uterus, and male factor infertility. They will account for almost all of the cases of infertility.
Correct. So, very important point to remember on this. But, ma'am, and what about males? Like, what are the common reasons which affect a man's infertility? Like you just said, that these fertilizers in rural areas are a big factor for exposure. Also, what are the other reasons which we think male infertility can get affected in urban and rural both?
See, the interesting thing is that we always correlate sperms or sperm health with fertility.
Right.
But actually, sperm is the only cell which is alive outside of the body.
Hmm.
So the semen analysis is actually a report card of the health of a man.
Hmm.
So not just fertility, but anything that is affecting a man's health is going to have a reflection on the sperm. So a person who has a poor sperm count, usually you can find some reason. Maybe he had a viral illness in the last 3 months.
Hmm.
Maybe he has some systemic disorders, maybe blood pressure or uncontrolled sugars, or maybe a hormonal imbalance in the thyroid.
Right.
Very often it is because of smoking. Tobacco use in different forms, it's rising like anything. And it's so much that you can look at the report and say that this man is a tobacco user because it affects the structure of the sperm, something called as sperm morphology.
Right.
So yes, lifestyle, any underlying disease which is affecting the health, of course, exposure to certain chemicals, radiation, all the high temperatures. The many of them who work in factories where there is a very high temperature, and sperms are very, very temperature sensitive. So
Right.
all these factors definitely have a role on the fertility of the male.
Right, very important. And there's a very interesting question which I received, and I wanted you to answer this because this is a very common scenario, especially in urban population, that if a woman is taking all precautions to be healthy and preconceptually she's taking all her multivitamins and eating healthy, but her partner is into smoking and a lot of alcohol consumption while they are trying to conceive, can it contribute to infertility?
See, as I said, 50% of contribution is going from to be from the sperm. Now, the traditional teaching was that prior to conception, a lady should have reduce her weight if she is overweight or obese. She should cut down on smoking, stop alcohol and smoking altogether. But
Right.
now there is very definitive data that obesity or a very high weight in the male
Okay.
actually causes reduced sperm parameters.
Okay. Okay.
Tobacco use, as I said, not just that the man is smoking, but if the woman is around him while he's smoking,
Right.
passive smoking can also affect her tubal health.
Right.
So, whatever were the rules which were traditionally told to women, actually all of them apply more to men in today's day and age with the evidence that we have.
Correct, correct. Very important. So, ma'am, what do you suggest? What is the ideal time for both men and women to avoid the intake of these kind of exposures to have a healthy fetus or have a healthy pregnancy throughout? What is the ideal time? Say 2 months before you should leave. This is a very common question which I think many young couples are facing these days. So, what's the ideal time you suggest?
See, what happens is that I would look at this in a very different way.
Hmm.
See, what happens is when you are preparing your body to conceive, you're not just planning for a pregnancy. You want to be healthy enough to bring up your children and give them a good future.
Correct.
So, the moment you think that, I want to be a parent, that's when you should start a healthy lifestyle.
Correct.
And it doesn't stop when you deliver. You have to give a future to the children, you have to take care of them, so it has to continue from then onwards. Now scientifically what happens is that couples feel that I'll start planning for pregnancy,
Hmm.
and immediately that month or the next month or the month after that I'll conceive.
Yeah.
But practically what happens is that sometimes unknowingly in that particular cycle you have conceived and you have consumed a lot of alcohol, or say you've smoked or you've done some drugs. So then that is going to affect your child, because you will know of a pregnancy only after you've missed your period. On
Yes.
the other hand, it might be that it might take you a while, 3 months, 6 months, 7 months. So
Mhm.
there's no time limit that I can stop for 2 months and then after 1 month I can start again. So the moment you start planning, it's a good idea to shift to a healthier lifestyle.
So that's a very important point ma'am has covered. This being a doctor, and I have so many non-medical friends as well who are trying. There's a very common question which doctors are facing these days, especially with young couples. So that's the answer for you. Ma'am, my next question is, if a woman has one child and cannot conceive after trying for even 2 years, she has already got a one healthy child. Is this still considered infertility? Should they still get evaluated for the same?
Absolutely. In fact, it will surprise you that almost one third of my OPD is with couples who've conceived earlier and are now not able to. Now, again, if this is something which is called as secondary infertility in technical terms. So,
Right.
any person who's achieved a pregnancy once, that pregnancy could have been with the birth of a healthy child, or a tubal pregnancy, or a miscarriage, and is now not able to conceive, is a
Right.
case of secondary infertility. Now, there are mainly three reasons for this. We know that as we age, our fertility reduces.
Right.
So sometimes it could just be that you were healthy, you delivered, you are fertile, but as your age is progressing, your fertility is declining.
Right.
One very, very important cause is that the process of a miscarriage or a tubal pregnancy or a delivery can sometimes be associated with certain infections which can cause tubal blockages. So, whenever you have secondary infertility, the doctor will always check your ovarian reserve, your tubal status, and it will surprise you that most of the men think that no, I've had a pregnancy before, so there cannot be any problem with me. But actually, with time or with certain lifestyle changes or growing weight, there is a very high possibility that the sperm count is not what it used to be earlier.
Correct.
So it's equally important, even if the woman has conceived earlier, that the male partner should also get checked.
So important. I feel that many of us are going to take back such important points and remember this, that you're in this together, not alone. So ma'am, coming back to one person asked me, what are the basic tests a doctor does to find out if a couple, that is a woman and a partner, is having fertility problems? What do you think? The baseline.
See, that's what scares most people, that we'll go to the doctor and there'll be a battery of tests and they'll be painful and they'll be expensive. Practically, just remember three things. We need to know the sperm, we need to know about the egg, and we need to know about the uterus.
Correct.
And of course, the passage where these two meet, that is the fallopian tubes, we need to know whether they are open or not.
Yes.
So these are primarily the three tests the doctor will do. But also remember that doctor is not just out for a pregnancy.
Hmm.
Anything that can affect your health or the baby's health in pregnancy will
Right.
also need to be checked. So your thyroid levels, your rubella antibody levels, your thalassemia status,
Hmm.
all these are tests which anybody who wants to conceive must undergo, if they want a healthy pregnancy.
Right.
So essentially, off late, the investigations are not really more than 4 or 5,000, and they include both husband and wife.
Correct.
And on the first visit, usually we'll always do an internal scan,
Hmm.
as you can tell us better. What
Yes.
are the things that you would look for when somebody sends you a patient of infertility?
Yeah, so for infertility, whenever a patient is referred to a radiologist, an internal scan first is must. You should not resort to a transabdominal scan. That is a scan being done from your abdomen. Instead, you should do the scan transvaginally, because there is a remarkable difference in the delineation and the resolution of imaging. And you can ascertain many things, like adhesions and the endometrial lining, that is the lining inside your uterus. Also, obviously, the ovarian reserve, like ma'am said, so you can see the follicles, the follicle count, and any cyst or any other masses which are indenting on the lining where the baby is going to be attached in the future. So all of this information is gathered, and not only just the uterus and the ovaries and the tubes, but the surrounding adnexas, the structures which can impede on the uterus and cause miscarriages also, or problems in conceiving, that can also be ruled out. So yes, that is one of the tests which are done and should be done, baselining, before you try to conceive.
Absolutely. Absolutely.
So, ma'am, can a low sperm count or low motility of sperm, and obviously in a male partner, can it be treated by medication alone? Because, like you said, that a lot of them have been affected lately because of many exposures, like we just counted. So, can it be treated? Is it treatable?
Right. So this depends on mainly two things. So how low? So say if it's zero, there's no motility at all.
Correct.
Then such cases, usually it's difficult to bring it back to normal because usually there's some genetic component in
Okay.
these cases. Sometimes if it's a borderline case, so WHO says that progressive motility should be there in at least 32% of the sperms in the ejaculate. Now
Okay.
say if it's 20%, 25%, usually we are able to pinpoint a cause. Most of the times it's something called as a varicocele. Sometimes it's smoking. Sometimes it's exposure to very high temperatures.
Right.
Sometimes it's just a viral illness which he had in the last 3 months. So these situations usually can be improved. But as I said, if it's absolutely bad or if it's not responding to the medications in 1 to 3 months, see, sperm formation takes 1 to 3 months. So don't expect that I'll take a medicine for 5 days and there'll be a dramatic improvement. We can see a trend in a month, but usually it will take 3 months for the complete results to be out.
Okay. All right. That's a very important point to remember, that, usually it takes 3 months to, affect the medication. So be patient and go with the treatment protocol. So, ma'am, what are the different treatment options available for infertile couples? Infertility, IVF, IUI, these are some very common terms now everyone is aware of. But with that comes, oh my God, expensive. All right, and people don't resort to it, and they waste a lot of time, before they finally come to an expert and opt for these treatments. So just tell us something about that.
So broadly, if I tell you, see, it's mind-boggling, how many treatments are there, how expensive, how painful. But essentially, everybody should remember two things. The first one is what is known as treatment of the cause. So as you said, if the motility is low, we try and increase it.
Correct.
If there's a fibroid, we try and remove it. If there is a tubal block, we try and open it.
Right.
Now, this is usually the first stage of the treatment. So most of the times, doctors also don't want to put a couple through IVF. Most of the times we want that, we should increase their natural fertility. Whatever is the obstruction, try and relieve that. And that's it. But if normal treatments have failed, so you've received multiple cycles of tablets, follicular studies, the tubes have not been opened, motility is not improving, then in that case, what the doctors do is what is known as bypassing. So we just try and create the embryo outside and we put that embryo back. That's nothing but the process of IVF. Now, in certain couples, if the problem is a severe one, so absolutely zero sperm count, no motility.
Right.
So in that case, we don't even wait for that long. We will directly push them for IVF. Now, the biggest question which I get is that, we don't want IVF. We want to naturally conceive, or IVF is unnatural. So I want to give out this message that, any treatments are just assisting nature.
Right.
Baby is going to be in your womb for 9 months. You're going to deliver the baby naturally, feed the child. It will be like just another pregnancy.
Correct.
Only the 3 days of the existence of the embryo will be done outside. So practically, actually, every treatment that we undertake for any sickness is kind of unnatural if you look at it that way. So
Yes.
IVF is not unnatural. It's just assisting nature in a very small or subtle way.
Correct, correct. Such an important point, ma'am has mentioned, that IVF is there to help you, and it's as natural as it can get. In fact, many a times doctors do try, if everything is healthy, the ova and the sperm is taken from the parents itself instead of the donor. So it is as natural as it gets there. So thank you, ma'am. The next question is, ma'am, different associated diseases which are commonly seen in infertile couples. One of the very common ones, which I think many of the viewers would be knowing, is PCOS. But what are the other associated diseases which people should have a red flag about, that, all right, if I have this, I need to take care of it if I want to conceive in future?
Right. So I'll start with the male, because women are usually very conscious about their reproductive health. Parents, families are very, very conscious about a girl's reproductive health.
Correct.
Practically, if a man does not have descended testes, it will shock you that, there's so many men who come to us, they're not even aware that their testes are not descended, or the family knew, but they did not do anything about it.
Okay.
If there's any problem, the testis is not out in the scrotal sac, or if they have some surgeries on the reproductive tract, say hernia surgery, a hydrocele surgery, a varicocele surgery, maybe a torsion of the testis, any injury to the testis as a child while playing or something. Now, these men should definitely come and get a semen analysis done.
Right.
It's a simple test, absolutely painless.
Yes.
Plus, if they've taken any hormones, it's very common for men to take some testosterone supplements in the gym.
Common scenario.
All these men must be aware that they should get a semen analysis done, because this can potentially impact their sperm counts.
Correct.
For women, we know this. We talk a lot about endometriosis. We talk a lot about PCOS. Any woman who has a fibroid. So essentially, these 2 or 3 disorders, anybody who's had a tuberculosis before, it may not be of the uterus. Maybe she had a lung tuberculosis. Now, these patients should definitely come and get their fertility checked up, because that can potentially impact fertility.
And what about thyroid, ma'am? Hypothyroidism, you think, since we live in an endemic zone over here, what do you think? Is that also a contributing factor for infertility?
See, the nice thing about thyroid is that, now the test is so cheap. It's maybe just 100, 150 bucks, and, you can get your thyroid tested. Plus, there's a lot of awareness that, women know that thyroid is very common in women. So practically, there's absolutely nothing to be afraid of if you have hypothyroidism. If your TSH levels are normal with treatment, you're just like any other woman. So your chance of a miscarriage or a preterm birth or any complications is not increased if you're taking the medication regularly and you're ensuring that your thyroid stays in the range.
Many patients do come to us while scanning, they're very worried that I didn't know that I had hypothyroidism and I've already conceived, and will my baby also have a thyroid issue? So like ma'am said, it's very, very important for you to know that if you are taking your medication, and even if, you're diagnosed in the first trimester and your thyroid levels are in control, there's nothing to worry. You can still very well continue your pregnancy. So,
absolutely.
Yes. And also, ma'am, like a special mention to PCOS, since it's so common these days, especially for young girls, they are very worried that long-standing PCOS, which is untreated, later on they're going to get married and they're going to have a fertility issue. Is that the real scenario which we're facing in day-to-day life? Can you comment on that?
It's both ways. So PCOS is definitely common, but we need to understand that actually 30% of women with PCOS will conceive naturally. So if a young girl has PCOS or somebody who's just married and has PCOS, please don't think that, now you'll have to go for IVF.
Yes.
30% of you will conceive naturally. The remaining 70%, practically almost half of them will also conceive with just a tablet which is taken for 5 days.
Correct.
It's just 10% who will eventually require maybe an IUI or some hormonal injections or IVF, but that proportion is very small. So if you're controlling your weight, if you're exercising regularly, if you know you have PCOS, then probably it's not that big a deal to conceive.
So, ma'am, there is a very common scenario which many patients are facing. They are trying to do their best, to live a healthy lifestyle, but the PCOS is not under control, and they still do want to go ahead with their pregnancy. They want to conceive. So, there are tests available. Just a special mention, like follicular study, you also do on day-to-day basis to track the follicles, and many a times PCOS patients can easily conceive, like ma'am said, naturally. In fact, because they have a delayed conception phenomena and the delayed ovulation phenomena in which they conceive later. So it's just the tracking of the follicles, or for common people, tracking of the eggs per se, so that they know that that's the right time to try and they can conceive accordingly. So there are many options available. If you don't need to be scared, even if there are so many common associated diseases associated with infertility per se, but don't be scared. There is solution to, I think, almost 99% of diseases these days, and that's a very good chance for everyone over there. So, ma'am, since we talked about the treatment protocols, everyone, starts talking about, okay, IUI, IVF, but I want you to briefly tell me the difference between the two, so that if a patient wants to actually plan taking these treatment protocols, they can actually decide, all right, I can opt for IUI or IVF. Please tell us something about that.
So I'll make it very simple. See, basically what happens is that human reproduction, it has got three bottlenecks. So bottlenecks are the places where there's a problem. So the first problem in human beings is that we don't know when the woman ovulates, right? There are no symptoms of ovulation.
Right.
So the first problem why some couples do not conceive is because they just miss that time.
Right.
The second problem is the distance. See, the sperm is just 5 microns and it has to cover 15 to 20 centimeters to reach the egg.
Right.
Now, sometimes the sperm may not be good enough or the passage may be problematic. So the second bottleneck is the fusion, that is the fertilization.
Right.
And the third and the most important bottleneck is implantation. So finally, an embryo may be formed, but it doesn't stick through the lining.
Right.
Now, essentially, look at IUI as in you're just looking at the timing. So exactly when the follicle is going to rupture, you're putting in the sperm and you're reducing the distance.
Right.
Now in IVF, you'll go one step more and you'll take out the egg, you'll fertilize the egg. But the third process, that is implantation, that's still left to nature.
Right.
So while in IUI, maybe you can get a 15 to 20% pregnancy rate. In IVF, you'll go one step more, so you'll get a 40 to 50% pregnancy rate. But there's no process which can ensure that this egg will implant, fertilized egg will implant. And so the highest treatment that we have is IVF. IUI is simpler, but then the success rates are modest.
Right.
It's more natural in the sense that we are not taking the egg out. But the important thing is that IUI will not work if your tubes are not good enough. It will not work if the sperm is not motile enough. So there's a very specific indication for IUI, very specific indication for IVF, but none of them are 100% successful.
So that means that if you are planning to opt for these kind of procedures, first and foremost thing which you should do is consult an expert like Dr. Priya or Dr. Soumya. Yes, so a radiologist and an infertility expert opinion is a must before you try to do all these tests, or you go ahead and plan to take any treatment, or you take a conclusive decision that we want to go ahead with these things, because the doctor can guide you accordingly which kind of treatment protocol will suit you the best. So yes, that's that. So ma'am, my next question is, many young couples are opting for frozen eggs and frozen embryos, and they're storing them for future because they say that till 35 these days, 35, even 40, many couples are not ready for children. So they have this concept that they're going to store their eggs and maybe later when they're ready, they're going to opt for that. As an infertility expert, what's your take on that? Does it really work? Is it good? What's your take? Please say something about this.
What happens is that whenever anything new comes in, so everybody thinks that's the panacea, and everybody should do it, and that's the thing to do. Eventually, we realize that there is a reason and there's an indication for everything. Now, egg freezing is very good in the sense that not everybody in their 30s will be with a stable partner or would want to conceive, or there's some medical issue because of which they're not able to conceive at that point. Right. Now we know that God is little unfair to women when it comes to fertility, because our fertility declines significantly with age, not so with men. Right. So egg freezing is a boon to these women. Yes. But let me give you a very sobering statistic. So suppose I've frozen one egg for a lady. The chances of live birth or healthy baby from that egg is just 2 to 5%. Oh. So that's not very high. So you require at least 10 to 20 eggs in order to get a reasonable pregnancy rate. Right. So remember that it's not a panacea. It doesn't guarantee that you will conceive. It can give you kind of a fallback plan or a plan B in case, eventually things do not turn out the way you expect. Right. In case the lady is in a stable relationship, she's married, in that case, I would prefer that they freeze their embryos, because with one frozen embryo, the chance of pregnancy is as high as 10 to 15%. Okay, that's a very good chance. Right. So, ma'am, what is the time period, of a frozen embryo or a frozen egg can be placed? Like,
Is there a time period? I have no idea on it. I think our viewers would want to know.
Right. So when we freeze the egg, essentially what we do is we remove most of the water out of the cytoplasm, and the metabolism of that cell just comes down to zero.
Okay.
So theoretically, you can freeze it indefinitely.
Okay.
Usually, 5 up to 5 years is good enough. We've had pregnancies at 11 years. That's the highest which I've had personally.
Okay.
But I think, if you've frozen eggs, then it's better to use them within the 5 year.
So, ma'am, my last question now, and this has been lately really talked about, PGT or pre-implantation genetic testing. Please emphasize on what's this for our viewers.
See, what always happens in IVF is that, couples feel that, doctor, you've seen the embryos, they're looking good. So now will the baby be better than the others? Or, this embryo is not looking good. Will there be an abortion? Will the baby not look so good? So essentially what the problem we faced is, when we look at embryos, we don't know how they are.
Correct.
So PGS goes one step ahead, and what it tells us is what is the genetic composition of this embryo. Now, in certain cases, it is very important. If the couple is carrying a genetic disease, say thalassemia or sickle cell anemia or motor neuron disease, then you can look for that mutation in the embryo, check and transfer only the healthy embryos, the ones which do not carry a disease. So you are preventing the disease from happening. Sometimes what happens is that couples have normally good looking embryos, but they carry genetic defects. So these embryos they implant, and the couple has repeated abortions. Now, in such situations also, you can check the embryos. The normal embryos you can put back, so the couple has a pregnancy which continues. It doesn't end in a miscarriage.
Correct.
But there are lots of things which surround PGS. It's not as simple, because you're actually taking few cells out of the embryo.
Correct.
So you're opening the whole of the embryo, going in, taking out these cells. So it's invasive in the sense that you're actually doing something to the embryo.
Right.
It's expensive.
Yes.
Plus, it involves a lot of expertise from the geneticist side. See, it's not easy to check very few 10-15 cells for their genetic composition. So yes, it's a boon. It's going to be a game changer in the future. Ever since we have started PGS in our practice, it's changed everything for us, because we are able to tell the couple why your IVF did not work out, why you're having repeated miscarriages. We are able to give a disease-free child to the couples who carry, bad genetic diseases.
So I think PGS is a boon, definitely, like ma'am said, especially if you know that you have a very strong family history associated, which is running in your genetic line. Then PGS can be a solution if you have opted for IVF, which you can test only on the embryos, right? Or
right. So we do a genetic testing for the couple. We zero in on their mutation and we test the embryo for that mutation. Okay. For miscarriages, we check the whole genome. So all the genes by NGS are checked in embryos.
So it is not compulsory that every time you opt for an IVF, you go ahead with a PGT test. But yes, if required, your doctor might suggest you so. So that's that, Dr. Priya. Thank you so much. You have answered so many queries. And in the end, I would also like to emphasize with these points you take home. And one important thing to remember is we know that facing infertility in itself is a very difficult situation. And you might feel that you're losing hope, but don't lose hope. Doctors are there, infertility experts are there, radiologists are there. It's very important and essential for a couple who thinks that they are falling into this category is to go to the right doctor, the right expertise, and take guidance accordingly. If with that, you will not only save time, but you will have better opportunities to have a healthy pregnancy. So with that, ma'am, would you like to say some concluding message for our viewers?
I would like to tell our viewers that Dr. Soumya, she forgot to introduce herself, but she herself is a very accomplished doctor. She is the leading and very young radiologist of our city. And it's a pleasure to see her reports, whether it is gynae or obstetric. And very, very important, I would urge all of you to follow her social media page, because in a very informal manner, she is giving very, very important information, which none of you should miss. So thank you, Iria, and thank you, Cura, for inviting me for this talk.
Thank you so much, ma'am. Thank you. That's really sweet of you. So I would again take this opportunity to thank Dr. Priya, IRI Kerala, IRI Bhopal, and Med Piper for being associated with us. And I hope we see you soon in another session next month. Thank you so much.
Thank you. Thank you so much. Bye.